Hi everybody, I'm talking to you on early pregnancy. Once you have become pregnant, you are very happy. I want the happiness to be continued throughout the pregnancy, enjoy it and not have anxious moments in your period of pregnancy. First is, these days everybody is knowledged with a home pregnancy kit. They check the urine at home and only when it is positive, they come with a fear and happiness, doubt. They have a fear whether we will say anything which is not there. They are happy to know whether something is there. So they come to us. So sometimes we are forced to recheck. But ideally, we check the blood levels of human chorionic gonadotropin hormone. This is called beta HCG test. The same hormone is checked in the urine, but the levels are more accurate in blood. So when the line is faint, the second line in a urine kit when you check is faint, or people having irregular cycles, they need not get worried. We can always supplement it with a beta HCG test in the blood. This level is very ideal to confirm the weeks of pregnancy, because from the 5th week it starts increasing. It doubles itself by 7th or 8th week. So it reaches its peak by 9 weeks. So this is a graph where we know whether the fetal development is normal. In other words, whether the embryo is growing well. This is the zygote, which we say the earliest embedded in the uterus. So, once the pregnancy is confirmed, the next question is, when is my expected date of delivery, doctor? There is a rule called Negle's rule, where we used to count back 3 months. For example, if a person has missed her periods on November 3rd, you count back 3 months and add 7 days. So, October, 7th, September, August. You count 7 days, it will be August 10th. Now, here again, the delivery date can be 1 week before or after. This is a rough calculation. For the fetus, it's a total journey of 40 weeks. This 40 weeks is divided into 3 steps. That is, early trimester, that the early pregnancy, the mid-trimester, that is after 4th month. The 3 months completed, thereafter it is the 2nd trimester, up to 7 months. Then the up to term, after 7 months, it is called the 3rd trimester. So there are 3 stages. So in this, what is the precaution and the guideline, the necessary investigations for early pregnancy? Once you have confirmed that you are pregnant, there are some basic investigations which are very important. Many educated women go through the Google or many videos which help them to know what they require, or they may be knowing. For example, their blood group and RH, their liver function test, especially jaundice screening, they would have done during their college days. HBsAg we call it. We add these tests if it has not been done prior to pregnancy, during pregnancy. In the blood group, it may sound very simple, but many times, in a small percentage, we come with surprises. The person not knowing their blood group and also not knowing their RH typing. Blood group, you know, it is A, B, O and AB. These are the 4 blood groups. In RH, that is rhesus monkey we call it, it is positive and negative. RH positive, RH negative. So the blood grouping becomes very important during early pregnancy, because if we identify the mother as RH negative, we do the blood grouping of the husband also, and if he is RH positive, we give them some special precautions and advice. So this is regarding blood grouping. Your hemoglobin is very important. There are some serology tests which is mandatory, you all know. One is HIV 1 and 2 and VDRL, venereal disease serology for syphilis. So these tests are also added during your first trimester screening. In every case these days, we do a fasting and a postprandial blood sugar also, because age of marriage is increasing. With family history, they can be in a pre-diabetic state. So we have to take extra precautions. A urine complete examination to rule out infection, and if it is positive, a culture. A gentle pelvic examination is done by certain people, while some would defer it for another 2 weeks. The next thing is the questions asked by the mother. If she is working, she asks us, when can we go for work, or how long can we work? The second question is diet and sleep pattern. What type of lifestyle they are adding, because in early pregnancy, this is very, very important. If you should enjoy pregnancy, the diet should be at least minimum of 30% of protein, rich in vitamins and minerals. The fat could be less, starch should be adequate. In the early pregnancy, again, exercise. All normal activities can be pursued unless they have certain other complications like heart disease complicating, which has been undiagnosed during the pregnancy state. So normal exercise, normal work and sleep pattern is good. We ask you not to overeat or undereat during early pregnancy, because you all know that more than 50% of the women have morning sickness. The morning sickness is nothing but a fall in the glucose level due to the change in metabolism occurring in the mother. So her sugar level drops. She feels nausea, vomiting, giddiness. In certain people, there is a little bit of irritability, but in a very small percentage. It is called hyperemesis gravidorum. Their vomiting is non-stop. We may have to give them IV fluids and support them. Other important aspects of pregnancy is what are the precautions they should take. In a very, very small percentage, spontaneous abortion can occur. So we should say that if you have any spotting or bleeding or acute pain in the abdomen, it is not to scare them but to tell them, so that they do not overexert themselves, like lifting heavy weights, unnecessary travel. These things they can avoid. They should be educated on this aspect. Eating good food is important. Good hours of sleep. And most important, a positive attitude towards pregnancy. This is the screening which we do at 4 to 5 weeks of pregnancy or 6 weeks. Many patients come even on the 33rd day and then ask us, when do you do a scan? You must understand that such early scans are unnecessary, but there are some exceptional conditions when we do an early scan. For example, a woman misses her periods, or the periods has been very scanty and it stopped. She's not very sure it is whether a normal period or not. She develops acute pain abdomen. There is mild sweating. These patients are important for a scan. An ultrasound examination will help us to pick up early tubal pregnancy, you all know the uterus has two fallopian tubes. The fertilized ovum has to travel through the fallopian tube to reach the uterine cavity. A very, very small percentage you can get what is called a tubal pregnancy. These days we don't see ruptured ectopic, which we were seeing in our student days, patient coming with pallor, collapse, abdomen bloated with blood in the cavity. We diagnose clinically ectopic and do a laparotomy or open up the abdomen to catch the bleeding point and then save the patient. Nowadays, beta HCG levels and ultrasound complementary each other, and we are able to pick up these cases even in the unruptured state, when laparoscopy and laparoscopic guided HCG injection is also available, so that the tube is sometimes saved or the tubal rupture is prevented. Similarly, in some cases, the patient has spotting from the beginning. These cases also we do early scan. Otherwise, routine scan can be done after 8th week of pregnancy. Is ultrasound necessary for all patients in the first trimester? These days we will say yes. One is the reason to rule out ectopic, whether the uterine sac is normal position, whether the fetal heart is viable. In a small percentage we get what is called a molar pregnancy. That is, instead of the fetus, there are vesicles or placental tissue alone which proliferates, and there is no fetus at all. There is no embryo, only the trophoblast proliferates. So these are conditions we call in Tamil Muthu Pillai, this trophoblastic disease. These were things very common previously, but now with ultrasound and HCG estimation, we are able to pick up very early and treat them adequately. So this is early pregnancy. Then, how do I take care of my body? Take fresh air. If you are in the habit of doing yoga or good exercise, continue doing it. And most important, you do not overeat or undereat. Do not overplay or underplay. Relax during pregnancy. Drink plenty of water, fresh fruits, and then care of the breast also is very important. Early pregnancy, the earliest changes you see in the breast development. So many of us advise in lubricating the nipple with the oil, any bland oil, so that the nipple becomes supple from the early stages, so that when you deliver, you have better method or a soft breast for feeding. You don't have a cracked nipple or a painful breast. There are many good events in early pregnancy, and once you diagnose a fetal heartbeat, we also measure the crown rump length, that is the fetal measurement, and then we ask them to repeat a scan in the second trimester, when we will be doing for anomaly scan. In the early pregnancy, we are bound to explain to you the complications in certain conditions. High-risk pregnancies need to be more careful. A woman above 35 or who has had a previous bad obstetric history, that is recurrent abortions, or a woman who has conceived after a very long time, or after previous surgeries she has conceived, these cases will require extra care, and your obstetrician will guide you to go through a smooth pregnancy. So, early pregnancy is only up to 12 weeks. So, after the 8th week scan, then they will decide when the next ultrasound should be done. We also screen these days routinely for rubella. Actually, rubella screening should be done prenatally itself before you become pregnant. But if that has not been done, we do it to see whether you are rubella positive. So, enjoy the early pregnancy, It is going to be a great event. We sail first 3 months and then we go on to the second trimester. Have a good day.